It's 9.
Now you're talking. About 10 minutes after 8 o'clock. Of course, summer in Grand Prairie is all about the smells, right? Smell of chlorine in the air and steaks barbecuing and sunblock. And that's why we are taking this opportunity to point out that it is Sun Awareness Week. And who better to talk to about the sunshine and your kids and everybody in the family than a dermatologist? Dr. Christine Malcolm practices right here in Grand Prairie, and she's on the horn with us this morning. Hi, Christine. How are you?
Hi, Paul. Good, thanks. Thanks for having me. Appreciate it.
Oh, no problem at all. So I want you to tell me if I'm reading these statistics correctly, okay?
For sure.
Last year, 76,000 new cases of skin cancer just in Canada. Is that right?
That's right. It's sure a lot, isn't it?
Holy crap. Forgive me, but holy crap. That's a huge number.
Yeah, for sure it is. And also melanoma cases, too. 5,300 new melanoma cases. So it's a lot.
Now, I mean, at my house, you don't have to explain the importance of sun protection. I have a redheaded wife, and I have a 15-year-old who's covered in freckles, so we know all about sunblock. But there are those still who kind of think they're impervious just because maybe they have dark hair or something like that. But that's not the case, is it?
No, it's not, for sure. I mean, basically, as a dermatologist this week, I just want to emphasize, protect your skin from the sun. And check your skin regularly for changes to your moles and any persistent non-healing spots that could indicate skin cancer or melanoma. But definitely everyone of all skin types and colors should be wearing sunscreen for sure. And protecting their skin from the sun.
Now, I mean, we some of us know the basics of skin protection, but I mean, what should we be doing more than just throwing on a baseball cap?
So basically, yeah, it's important to be doing other things too. So trying to be wearing sunglasses or sun protective clothing, often with long sleeves. And definitely wearing sunscreen, trying to avoid the sun as much as possible, especially during the peak hours of sun exposure, the peak UV time between 12 and 2, sitting in the shade, not sun tanning, and definitely avoiding tanning beds because those are really harmful for us.
Yeah. Jersey Shore is tanned enough for all of us. Thank you very much. The other thing, I know that we try to do our best around here. We run a UV report a couple of times a day, trying to keep people up to date on that.
Yep.
Now, speaking of UV, the one thing that does confuse me when I walk into the drugstore and you see the wall of sunblocks and the ever-ending numbers and what does this mean and what does that mean, I haven't got a clue. Can you help, please?
Yeah, for sure. So basically, the most important thing is to look for a sunscreen that has broad spectrum protection. So you want to make sure it says on it UVA and UVB protection. And then look at the number. So you want to make sure it's at least SPF 30 on the body and ideally SPF 50 on the face.
Oh, see, there's something right there.
Looking at both things, numbers and also protection.
See, now there's something I didn't know. That makes perfect sense too, right? I mean, your face is going to be taking a bigger brunt of it, so a little higher on the face than you would on the body, maybe?
Yeah, for sure. It's a great idea because definitely skin cancers are often most common on the face as well.
All right, then I guess the last question I want to ask you is about putting this stuff on. Perhaps not slapping it on the ninth hole of a golf course. You should probably be doing this a little earlier, right?
Definitely. We generally suggest applying 20 minutes before you're going out in the sun, every 2 hours, and then also after swimming or sweating really excessively. And also make sure you're applying generously, because most people only apply half to a third of the amount that they need to protect the skin. The more, the better.
Yeah, that's the difference between an 8-year-old applying it and mom slathering it, right?
Slathering it on, eh?
Yeah. Now, you do have a website where you can find out more details about this in case people are in the car and they don't catch all the details. What's the website?
For sure. It's www.RejuvaDERM.ca. And I have information, too. It talks about sun protection and sunscreens and a little bit on that melanoma as well. So, thanks.
Now, I understand you also want to kind of get people pointed in the right direction, so you have some product as well that you want to kind of give away as well. Is that right?
For sure. That would be great. Yeah, it's my favorite sunscreen for the face.
Okay, what is it?
It's just a new sunscreen that's come out. I think a lot of patients, especially a lot of my patients with acne and oily skin, are always concerned about putting on sunscreen that could block their pores or make them feel like they're greasy and turns their skin white. So it's just a new sunscreen that's come out by SkinCeuticals. It's SPF 50. It's sheer, it's transparent, it doesn't leave a white film, and it has no chemical filters or parabens.
Okay, terrific. I tell you what, if you drop some of that off here, we'll keep tooting the horn about Sun Awareness Week, and we'll give some away over the next few days. How does that sound?
Sure, that would be great. Thanks, Paul.
All right, thank you, Dr. Christine. It's been a pleasure talking to you, and very informative as well.
Thanks so much for having me. I appreciate it.
Have a great day. Bye.
Okay, bye.